Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and this morning we're going to be discussing case number 00352, 3-year-old poodle mix with itchiness and anxiety. The anxiousness probably stands out most primarily, and the question is why? So why itchy, why anxious? And we come over to the analysis, and the chronic phase would be represented in red, usually something that's less than 47. We had none of those. The acute phase is going to be greater than 55. We had 2 of those, the small intestine and also the TW3, which is actually the sensory circuit. So it really makes sense, these two, the enteric nervous system is represented by the small intestine, and the sensory circuit being stressed is represented by the senses that come in. So sight, sound, taste, touch, those are things that are going to be important if we're dealing with anxiousness, because the anxiousness here, represented by the heart, small intestine, the emotion is anxiety. It supports the GI tract, so if we're anxious here, we may see interruption in digestion at times. But also the heart and small intestine control the lung, which the skin is represented by the lung and large intestine. So if it's going to the skin, the anxiety is being expressed through the skin as itchiness. So it's a behavior versus an allergy. And if you look on the analysis, you'll see the allergies were balanced, so we're not dealing with itchiness because we're allergic, we're itchy because we're anxious. And so there's a big difference. And so how we manage the therapy is that we want to balance the SI and the TW3. So we infuse with hemp oil for those particular things. Unlike the hemp oil before, we are going to be using one that's specific for the imbalances to try to reduce anxiety. Nutritionally, Cataplex AC is for the CNS, and specifically for the TW3. When we go into the library, we ask specifically on the standard process, which is a really good product, is which one would benefit nutritionally to add to the diet that can help us with the condition. And so Cataplex would be given daily along with the hemp oil for 3 months. We can come in with essential oils. There's one called Endoflex, which is there again specific for anxiety, so it's going to balance those. Endoflex is something that can be infused through an infuser, or it can even be placed on the skin with certain dilution oils, and so that can be helpful if you like to use essential oils. We did test back on the rabies, which we cleared for rabies vaccine, so we want to still be cautious about, because it's a central nervous system issue, is I would probably hold off on rabies vaccination right now, write an exemption until we get the problem corrected. Number 2, we talked about Soleo, which is more of a conventional anxiolytic for episodes of anxiety, and so we tested back on that, and that seemed helpful as well for those times where they're really anxious and they may just need episodic treatment. Long-term use, we got Bach flower still pending. We want to run that through the library and see which Bach flower specifically might be helpful as well, because Bach flowers are based on emotion. So what we want to know is what kind of emotion could we treat, because the dogs won't unfortunately discuss their anxieties with us. We just have to interpret it. So Bach flower is running through the library. Is still pending, so once we get that, we'll have that ready to go. So I hope the video is helpful. It gives us kind of some clarity. You can look at it over and over, but if you should still have questions, you can call our number 847-541-4005, the Grove Animal Hospital, or grovepets@yahoo.com is the email in case you have after-hours questions as well. And certainly at any time we're open to questions as we work through this process. Thanks so much.